Board of Health, April 3rd. Sound check one, sound check one. Sound check two, sound check two.
Madam Chair, we're now live.
Good morning. Good morning. I'm calling the meeting to order. It is April the 3rd, 2023, and this is the Board of Health meeting. Members of the public are advised that our meetings are webcast live by the City of Hamilton and archived on the city's website, and that the presentations and reports considered at this meeting are available on the city's website, and that members of the public can contact the clerk's office to acquire these documents. Members are reminded of the 5-minute time limit, which will be adhered to. There is quorum, and I am joined today by Councillor Alex Wilson, Councillor Mark Tattison, Councillor Ted McMeekin, Councillor Cameron Kretsch, Councillor Tammy Wang, Councillor John Paul Danko, Councillor Brad Clark, Councillor Craig Kazar, and virtually I'm joined by Councillor Jeff Beattie, Matt Francis, Esther Pauls, and Mike Spadafora. Good morning. There are no ceremonial activities today. Mr. Clerk, Elsie Gauthier, are there any changes to the agenda?
No, Madam Chair, there are no changes to the agenda.
Okay, it's moved by Councillor Kretsch and seconded by Councillor Wang to approve the agenda as presented. Any discussion? Seeing none, thumbs up from Councillor McMeekin.
Just your vote, Madam Chair.
Sorry. Carries 13-0, and I forgot to welcome everyone to the month of May, which apparently is the cruelest month. April. Yeah. Oh, see, that was my belated April Fool's joke. Yeah. I'm still recovering from my daughters. Any declarations of interest? Seeing none. Approval of the minutes, moved by Councillor Kazar and seconded by Councillor Clark to approve the minutes of March the 20th of 2023. Any discussion? Seeing none. Thumbs up for me. Thumbs up from Councillor McMeekin. Thumbs up from Councillor Clark. It's a toss-up. Carries 13-0. Excuse me. I need a mover and a seconder to put the communications on the floor. Moved by Councillor Alex Wilson, seconded by Councillor Mark Tattison. Any discussion on any of these items? I recognize Councillor Tattison.
Just item 5.3 was addressed, it was dated March 24th, 2023, and it was addressed to Mayor Fred Eisenberger, and I'd just like that noted, that to have that changed. I will willingly accept the funds or the increases in the one-time funding, but just want to make sure we get the right mayor.
Thank you, Councillor Tattison. It is duly noted by the Office of the Clerk. Any other comments? If I could relinquish the chair to Councillor Clark, I would like to speak to item 5.4 briefly.
Go ahead, please.
Thank you. For the public, this is correspondence from Joe Preston, who is the Board of Health Chair from the Southwestern Public Health District, and Cynthia John, who is the CEO of the Southwestern Public Health, in support of ALPHA's 2023 pre-budget submission. Just to note, that budget, of course, is passed. There was passing little reference to public health in that budget, just as there was very little reference to public health in the economic statement that preceded it, although there were, I think, 16 or 19 references to roads and highways. So that is disappointing. There is, the government rescinded the 3 days of sick leave that were active during COVID, and that also has been rescinded, despite the recommendation put forward from your Association of Local Public Health officials and groups and boards such as this one. I do note that later on in the agenda, there is a look back by public health staff on what lessons we have learned. And I guess I would make the statement that if this continues in the underfunding of prevention and public health, we haven't learned very many lessons. So public health is an investment. It's fundamentally important component to a thriving, growing, diverse economy. And I hasten to say, if we do not learn the lesson of COVID, then we're not going to achieve all that Ontario is capable of. Thank you for taking the chair. I will take it back. We'll have a vote on that communication, please. Thumbs up from me. Thumbs up from Councillor McMeekin.
Sorry, we'll just need to vote again. I just accidentally closed it.
No problem. We just had a malfunction, and if we could all vote again, that would be appreciated. Thank you. Thumbs up from me, thumbs up from Councillor McMeekin.
Councillor Danko?
Okay, thank you. That carries 13-0. We're on to consent items. 9.1, may I have a mover and a seconder to put Public Health Services COVID-19 After Action Report on the floor. Councillor Wang, seconded by Councillor Clark. Sorry. Any discussion on that? If I could ask perhaps our Chief Medical Officer of Health to give a quick overview. I think it's an important evaluation for us to discuss. Thank you.
Thank you, Madam Chair. It is indeed. The EOC for the City of Hamilton did theirs back in October, having stood down earlier on. For us in public health, the emergency was a little longer, beginning in January of 2020 and taking really all the way through to the end of last year, and that's the time period that's covered by this report. You know, it was absolutely, this report lays out the successes that we had and the degree of collaboration, the degree of hard work that was done by the staff across public health services, the hospitals, the family health physicians, the pharmacies, all pulling together and responding collaboratively to COVID-19, and further built relationships that we continue to rely on today when we're talking about programs and services. You know, although we outline how resilient our staff were, there's no doubt that absolutely the time and toll that it took, the workload demands we had, as people will hear me say from time to time, we had people right on that cusp of employment standards level of workload, not because they were really being scheduled for that, but because they were volunteering and coming forward to work on those days. The challenges, though, for the workforce, both in terms of their mental health, their exhaustion with dealing it, are significant, as was working in an IMS structure for a significant period of time. I believe, we've talked about organizational structure through the budget process at times and at other times around this table. And with the flat organizational structures that we have, it's very difficult to stand up an emergency response. It's difficult, quite frankly, day to day in many of our programs, but it's very difficult to stand up an emergency response, especially for almost 3 years to go through. That said, we learned a heck of a lot. I mean, as I said, the relationships that we built were significant. The use of technology for things that we haven't been able to do before. So when we have inclement weather, we can switch to virtual appointments so that people don't have to come out and drive to things like our alcohol, drug, and gaming services. We've done, gotten back in with the schools and are doing good work. Jen was just speaking about the really good work that the school-focused nurses have been doing with our communities from a health equity standpoint, building that into the schools and the work that they're doing there. Unfortunately, those school-focused nurses, actually the funding for them ends in June, as you would have seen in the one-time funding letter. But many different things that we learned and that you can see outlined there. And then going forward, really looking at how can we do this best if we do this again. And so if we stand up another vaccination effort of this scale and magnitude, and of course, in some ways we will, the vaccination program that continues on for COVID-19 is far bigger than anything that we have done for some time. And so trying to understand too what the province's funding arrangements will be, what their expectations of us will be. We're still very much in a mode where we're adjusting regularly to what the expectations are as things roll out. So there's many recommendations there, which our staff will continue to follow up on, as well as the ones that came out in the Chief Medical Officer's report from last week. And we'll continue to bring forward to this committee any changes or pieces that we think are important for you to consider as we move forward. But just, again, a huge thanks to all of our staff, a huge thanks to all of our partners across the community, and to all of council, the former council, and to this council as we go forward, for giving us the time, space, the confidence, the courage to carry out what happened over the last 3 years.
Thank you very much, Dr. Richardson. I'm going to recognize Councillor Wang, please.
Thank you, Chair. Through you, just wanted to get a sense for, I think, the data around things. I know that we did receive a significant amount of data. I know it has been already shown in this report, but moving forward, I see in some of the recommendations it says improve the efficiency and program delivery using software applications that can also be leveraged during an emergency. So I wonder, what sort of evaluation did you do on this existing round of software and program delivery? And then what were some of the lessons learned, and how are we actually applying that moving forward?
Dr. Richardson.
Through Chair. So it's a challenge for us when it comes to technology, because we seldom get to choose our own technology. Either the province is choosing what they think is best for the province as a whole. And when we look at things like Covaxon, which was the vaccine software, and other software that we have in place, that's most often the case. And so really being at the table, being an advocate around what is needed at the local level as opposed to the provincial level is really important when it comes to case management, all of those sorts of things. As well within the city, it's a bit of a challenge because we're often looking for the best software to do what we need to do all across the city. And so when it comes to issues like privacy, those sorts of things, trying to work through the challenges, we're constantly working with our IT folks to, try and do that proactively rather than doing that reactively. So we had some challenges. For example, we had bought Virto as a vaccine booking system, which we tried the provincial system, and that wasn't working well for us because we couldn't make adaptation and changes, in a way that suited Hamilton, including the rollout of vaccine to vulnerable populations. So then we bought our own system there. Then we needed to go to the corporate standard when a new corporate standard was bought, but it doesn't do the reporting and things that we need to do our piece. And so that piece about, having the time to proactively look at the things that work for us, for all the needs that we have all around the city, but not take so long and bog it down because technology changes so very quickly. And staying up to date is very important. So, we're still working those things through, but those are probably some of the key ones. I'll just turn to Jordan in particular, whose programs were affected through it, and see if he has anything to add.
Thank you. Through the chair. Yeah, not specific to evaluation of this, but as Dr. Richardson has alluded to, in terms of a go forward, some of the pieces that were rolled out. So, for instance, the what's called the case and contact management system was a new system for all of the documentation, and it's from that. For instance, you would see on our website the information that's pulled out in terms of cases, outbreaks, etc., is being pulled from that system, and so we do understand that will be rolled out next. It was used for COVID. We understand that there is a plan at the provincial level to move ahead with moving all of infectious diseases from a system that actually I believe came out post-SARS to this newer system. And so, continuing to look at, and as Dr. Richardson had alluded to, not that we can necessarily direct where that goes, but advocating at provincial tables as to the sort of functionality that we'd like to see in those systems and how that can support our work and support our reporting as well.
Thank you.
Chair, many of my council colleagues may or may not know, but I was redeployed in the early part of 2022 to work in the mass vaccine clinic. So I have firsthand experience working on Covaxon and the Verto. And I was always surprised as to how much money went into that, except they don't talk to each other. So there was many times the user experience was really tough for the vaccine clinic workers. So I hope that as we're coming out of this, that Dr. Richardson's sort of point of like taking a little time to explore what technology looks like and how does that work, especially when it comes to privacy, because just the sheer nature of how you were transferring on and off Covaxon, and also how you had to transfer information into Verto was really challenging. As a follow-up then, through you, Chair, to Dr. Richardson, how are we maintaining the monitoring levels? Because I know currently we are moving away from a lot of the monitoring, but a lot of this respiratory is still out there. COVID is still real. So how are we maintaining a bare minimum monitoring for actions moving forward? Through you, Chair.
Thanks, Councillor Wang. Yes, Jordan, thank you.
Through the chair. To the councillor, thank you for the question. So while we have moved away from some of the more intensive, for instance, COVID case management that was done and contact tracing that was done in the earlier days of the pandemic, there are still minimum requirements in terms of those cases. Lab reports are still reported to us. There are still minimum data entry elements that we are collecting on those cases, both through hospitals and from hospital systems, as well as from through outbreaks and line list reportings from institutional facilities that may be experiencing cases and outbreaks. And so we continue to enter that data into the case and contact management system, and so it continues to provide the same, not the same degree of surveillance maybe that we had. Surveillance is probably the wrong word. The same degree of details on the cases that we had in the earlier, for instance, things like symptoms, but we are still able to track the progression, the amount of cases, the level of activity, and so we'll continue to be able to report on those things through that surveillance and reporting.
Thank you.
My last question then, through you, Chair, is I was particularly enthused with how we were using the wastewater data. And is that something that we can copy and paste to other sort of infectious diseases through our community? And is that something that our system is able to continue to monitor and also evolve?
Thank you.
Through you, Chair, and I smile because I think of Councillor Danko and his work with us as we were sorting through about wastewater surveillance and how it fit into the program and not. And it's still very much a piece that's under study in terms of how it fits with our overall monitoring and surveillance. And so they've done a lot of work with it for COVID monitoring, and it does detect the virus and helps us to see what's there, but exactly how it's going to work as an early warning system is another question. And also how it can help us, because you don't have to have as intrusive of having a nasal swab and that sort of thing. You know, all of that's kind of in the wash and being worked out still as we go. And then they've been looking at other viruses over the course of this winter and looking at, you know, what is the correlation around influenza A, influenza B, you know, what can they find there? So the researchers are very much on it. You know, we've got some very prominent ones at University of Ottawa and others. There's a lot of federal interest, provincial interest. So it's being worked on, but as to how it's really going to ultimately fit into our surveillance system and what it's going to tell us, that's still, you know, being worked through. The science is very much in progress.
Councillor Ryan.
Thank you. Those are all my questions.
Thank you. I have Councillor McMeekin followed by Councillor Clark.
Yes, thanks, Chair. Good morning, Dr. Richardson. How are you? Good. Just a quickie on the wastewater. I heard an interview with the mayor of New York City about 2 weeks back, and New York was one of the pioneer big cities to take the wastewater testing as a possible useful tool, and he just swears by it. Apparently it's been quite quite effective in New York. Anyhow, that's just an aside. I wanted to ask, I wanted to say that e-health has always been a problem. I can remember some provincial days where, not only was it a problem, it became scandalous in terms of the inability of one system of family doctors, for example, to be able to talk to testing centers or other and it's been through several governments provincially. It's been a difficult struggle. So stick with it, please. It's important because the potential to inform and not just inform, but save a lot of money by coordinating these things is important. I wanted to ask, it's a little bit off the topic, but if you'd bear with me, about, it's got to be maybe a month ago, there was a report about the drop in the number of COVID tests that are currently occurring, coupled with a parallel 600% increase in pediatric COVID. Has that settled down a bit now, the kids' COVID? And
a little outside the scope, but I think it's an important number to hear from Dr. Richardson.
So when we've been doing, through you, Chair, when we've been doing the monitoring as we go through, we've seen COVID settle out at this sort of moderate level rather than, we all hoped as we transition from those big pandemic waves to, where we're going to land and understanding, is it going to be a seasonal virus, is it not? We were hoping we would level out a little bit lower. We've leveled out more at a moderate level in Ontario and across Canada as a whole. I'm just asking Jordan, I think from the standpoint of pediatric cases, I'm not aware of anything significant locally that we've had in the last little while. I mean, certainly RSV was a significant season for us, but from a COVID perspective, not so much. And Jordan seems to be nodding agreement.
Thank you.
Thanks for that, and thanks for the good work that you and your team are doing. It's appreciated by all Hamiltonians.
Thank you, Councillor. Councillor Clark, followed by Councillor Danko, and then Tattison. Councillor Clark.
Thank you, Vice Chair Wilson. If you recall, just prior to all of this pandemic stuff, we had just been elected. We were serving in the early part of 2019. The province of Ontario indicated that they had an ingenious idea. They were going to take all 34 public health agencies and mold them into, I think it was 7 or 8. It was a small number anyways. And I can remember raising a concern about what would we do in a pandemic, because public health is on the ground in our community and is able to surveil and gather data and information very fast and feed it into the public health department so that they can act. This shows that in action. And I'm hopeful that the government government of Ontario, to be clear, is cognizant of those relationships as they're doing their assessments on public health departments across this province. I'm very pleased with what Dr. Richardson and all of our public health staff and all of the volunteers, and if any of you went down to First Ontario Centre and saw in my mind, what I thought was going to be a logistical nightmare, and it went so smooth. It was amazing walking through that door. They were polite. They sent you to this one, they sent you to the next one, and each one you were basically getting information, and then they put you in line for the shot. The shot came, and then they monitored you and sent you home with a smile on their face, although you couldn't see it because of the mask, but I could hear it. I could hear it. So I just want to thank Dr. Richardson and our staff and all the volunteers, all of the Hamilton staff that were seconded, that were relocated to do additional services, and they didn't blink. They didn't say, oh, no, I'm not going. That's not my job. They took the training, they went, and they did it. And the city of Hamilton got through this primarily because of that type of work. And so I want to thank Dr. Richardson, all of her staff, everyone that assisted us, and of course our local healthcare providers who collaborated immensely throughout this pandemic with public health. It proves to me, anyways, that local public health is most beneficial to the residents in their own community. Thank you.
Thank you. It was like the Fred and Ginger of vaccine sites. Do you know who Fred and Ginger are? All right. We had some dated references this morning, and it kind of dated me. That's why my tongue-in-cheek to a reference of Fred and Ginger. Councillor Danko.
Thank you, Chair Wilson. Going through this report, I just wanted to highlight a couple things that just stand out for me. Starting with the timeline with 3 pages of milestone dates flowing through. I don't think any of us, when this started, ever expected that, 3 years later, we'd have that extended emergency, and, some of those milestones that are highlighted there being quite unexpected and challenging. So that context, I think, is really helpful to set the, to remember what it was like through the pandemic. Highlighting the successes, I think, is really important. Again, thinking about going through the context of all those milestones and the actions that we had to take as a council and as a city. I think it's really important to understand and acknowledge the amazing successes that we had and our public health team had through Dr. Richardson's leadership. There's a couple things in the challenges section that I think I just wanted to highlight. I'm not sure if I have a question, but I'll leave it open to staff if they have any comments. But there's kind of a theme through some of the challenges, and it highlights some of the uncertainty in the rapidly changing guidance from the province back in the early days, and how challenging it was for us as a municipality to implement provincial regulations and guidelines within days or even hours of them being directed, not having advance notice of what was coming, and how difficult that was for our staff to be able to respond. And I think that over time then evolved to the province actually taking a step back from making those decisions and leaving it up to local boards of health to be somewhat on their own. And then the one part that really stands out is there's a quote from Kevin McDonald, the Director of Healthy Environments, and this is the part that the pandemic sort of evolved to, and it just says, information saves lives. In the context of the COVID-19 pandemic, there has been an excess of information, false rumors, and manufactured disinformation, and that delivering evidence-based factual information in a timely and transparent way to multiple audiences via various platforms and continues to be challenging and critical. And I think that's the part of the pandemic for me anyway that I never expected, that we would be facing a disinformation, misinformation, sustained global campaign, and us as a municipality having to respond to that. So maybe if I could just ask staff to reflect on that, because for me, if we're talking about lessons learned, that is the number one thing that was unexpected and is probably at a local municipal government level the hardest for us to actually be able to address.
Yeah, who would have thunk it, right? That vaccines would be the enemy. Dr. Richardson.
Yeah, so the misinformation, disinformation, and I think you've seen there's been studies to show that it not only was, led to delays, but actually impacted people's health and well-being and cost people's lives through the level of misinformation that was out there. And absolutely one of the most critical things that we dealt with on very much a day-to-day basis at times. And thank goodness for the excellent communications folks, the tremendous communicators as well that we have amongst our staff, because this wasn't something that was, about our media responses or those sorts of things or town halls. That was certainly part of it. But these were things that everybody was doing day to day, whether it was a person on the hotline speaking to somebody that was calling in, whether it was a person who was calling up a case to talk to them about what they needed to do. It was a person in the vaccine clinic who was working things through. It was our vaccine ambassadors working out in the community to help them understand the information that they needed to have. And quite frankly, they continue to do that to this day. I think in part, though, it shows societally where we're at. And this isn't, the pandemic absolutely put this on stage in terms of what could happen, and the importance of, just equitable access to information, and that values come into play and they have to be there. And it's not about saying that there's one source of right. It is about the importance, though, of good science, of good knowledge translation, of good literacy amongst people across the country around what that looks like, around understanding misinformation and the role it can play. I think about my boys, and as they went through school, they had courses in how to understand information and not. And quite frankly, in some ways, on some things, they were better at it than many people I know who are older in terms of trying to understand information and how to value it, how to engage with it. So I think we're facing this problem on many, many issues today, and we just we don't see it highlighted the way that we have. And we have to understand where that dialogue and debate must continue, because understanding information, understanding what we want to do, sharing our values, making a way forward are absolutely critical parts of what we do together as society. But at the same time, figuring out what is actually going to hurt us and quieting those voices that can do that, I think is very important. And certainly we see that with Dr. Moore in terms of what he speaks to and the things that are important. We see that from our federal colleagues as well, and from our colleagues in academia. So we'll carry forward and try to do the best we can.
Thank you, Dr. Richardson.
Thank you.
Really appreciate the thoughtfulness of that response. Councillor Taddison.
Good day, all. Through the chair, focusing on lessons learned, and there's lots of recommendations in this report. The need to review data, exploring opportunities with other health system partners, improving efficiency, program delivery, developing an infectious disease program. You mentioned dialogue and debate. Dr. Richardson, can you expand on how do we as a city and our public health department leverage our relationship with local healthcare and research experts from McMaster University? And can you expand on the relationship that's currently existing, just for me to understand? Thank you.
Thank you.
Through you, Chair. Historically, we were what was once called a teaching health unit, and then a public health research, education, and development unit, and then all of that funding ended. And so we had a very formal relationship with McMaster during those days, but that relationship continues on. And of course, it's not only with McMaster, it's also with Mohawk. We have that relationship, not to perhaps the same extent with Redeemer, just because of the areas of focus that we work in, but also with Waterloo and to other universities beyond McMaster alone. But that piece comes through in a number of different ways. So on a very practical level, in clinical managing cases, just as Jordan described about managing some of those COVID cases and the cutting edge, tests and treatments that were coming out, working with doctors like Zane Jagla and Dominic Mertz and many others at McMaster from an infectious disease standpoint, infection control standpoint. We work with them regularly, day in, day out, on case management. As well as sort of understanding where surveillance and the best in disease control is and will go. We work with them, though, in all of our programs and services. So we ferret out and work together with experts. Jen, to my left, works with a number of them when it comes to healthy families and working with children. and Julie as well when we're talking about addictions and harm reduction and HamSmart. You know, there's many that we work on together at that level. On an education, it's absolutely critical for us from an education standpoint that we work with our educational institutions. Public health for many is a career they don't even understand exists until they're, you know, well past those earlier days of training and into the health workforce. And so being there, being present, working with medical students, nursing students, epidemiology students, all sorts of different students, business students quite as well, we've had relationships with, in order to bring in some people to both help us from a capacity standpoint. We get tremendous value in working with these students, but also to influence their careers, help them understand that public health is an important role that they can consider as they go forward. So we're on all of the levels as well. At the research, we don't do as much research as we did when we were, we had funding to do that work, but we do some research as well. So whether it's clinical management and understanding what best practices are, or whether it's education or whether it's research, we work with them across the board.
Thank you. Councillor?
Is there one recommendation you can cite that would kind of focus on that relationship that could be included in the report?
Thank you.
Madam Chair, that's an interesting challenge. I think I would have to come back to you on that one. I mean, the partnership piece is absolutely part of it, but whether there's something that we would bring forward, I'm not sure if you're asking if there's something additional or just to highlight the one that is there in terms of the collaboration.
I just think there's a wealth of information and energy and enthusiasm from students in programs that could be leveraged to solve some of these issues that the health department might be facing, and and get creative ideas from. And so if a more formal relationship there in all the problem solving and recommendations, I think that's my point. That's all.
Thank you, Councillor. Councillor Critch.
Thanks. Through the chair, I'm mindful that we're here talking about public health and the way that public health approaches this in terms of its understandings, its takeaways, its learnings. There's a bigger conversation here to be having about the impacts of COVID on the city, its workforce from a human resources perspective, the things we learned about working from home and how easy and hard that was in some ways. Will this kind of reporting be happening in a broader way from an organizational standpoint, or will we be looking at sort of just a public health response to it as we move forward? Do you know?
Dr. Richardson?
Through you, Chair. So the EOC for the city did a similar after-action report to reflect on the work that they had done in terms of from an emergency response standpoint. So I'm trying to remember the date of that report. Yes, thanks, Jen. September was when it came out. Ours, as I mentioned at the beginning, is a little more delayed because our response carried on, and the disruption to our programs and services carried forward through into this year, and so ours was a little more delayed in coming out. I think you also raised the question, though, of what the legacies, and Jeanette said it well last week, in terms of the impacts that came with COVID that have not left on our programs and services right across the city. And so I wasn't sure, Councillor, if you were actually speaking to that piece and a broader piece about the impacts of COVID from that perspective. I would say generally I wouldn't expect on that latter piece for there sort of to be a wrap-up report, but rather it will be in the work plans, in the budgets, in the reports that you see day in, day out as we go forward over the coming years in the legislative agendas that come before the council as a whole.
Councillor Critch.
Okay, thank you very much. I appreciate that.
Thank you. Councillor Pauls.
Thank you, and through the chair. Talking about misinformation, Dr. Richardson, can we agree that the virus was evolving and we did not know everything about the virus? And therefore, people in the community, people at large, question some of the virus. For instance, I remember even the President of the United States saying that if you get the vaccine, you cannot get the virus. Was that a misinformation? So my question to you is, can you just talk a little bit about it? How we learned so much with the virus, spreading of the virus, who can spread it? Because I remember clearly when I would go door to door, or I had to go and see somebody, they said, oh, come on in, I got my COVID shot, so I'm fine. To me, that was a misinformation that really you still had to be careful whether you were vaccinated or not. Can you comment on that, please?
Dr. Richardson, comment on how our knowledge grew over time?
Through you, Chair. So, yeah, absolutely. That was one of the aspects to this that made it challenging, was just how quickly things changed. And they continue to change. This virus continues to evolve. We're continuing to understand what it means. And I take the point well that as things change, that can feel like misinformation has come before when things were different. So if we think about that first wave with Delta and the first vaccines we had, absolutely they protected against transmission. They were a huge part in reducing the spread of COVID. And then when the Omicron wave hit, you know, we had a whole nother deal where it was suddenly so much more transmissible, where vaccines no longer could prevent transmission. And so I think that's part of the challenge from a communication standpoint, is trying to understand when is it that things have evolved, and staying up to date with the evolution of that information while continuing to maintain trust across, you know, our society in terms of what is happening. It's so very difficult when things are changing that rapidly to know what's accurate, to know what isn't, to stay up to date, and then to do the best things that we can as we move forward.
Thank you, Dr. Richardson. Councillor?
Thank you for that answer. And that is why critical thinking is very important. And when someone would talk to me or send me an email saying, but I don't believe in this, I can't because this is that, I would listen, and that's the point. We cannot say to people that are doing their research, their own critical thinking, that they're absolutely wrong. And I think we learned a lot that all information is important, and that we get the right information. And as this virus evolves, we're getting more information. So that's just my comment. And I do appreciate Dr. Richardson for your answer and for understanding that the virus was evolving and we were all learning from it. So thank you for that.
Thank you. Councillor Jackson.
Thank you, Chair Maureen Wilson, and forgive me for coming in late, so questions and or just comments are allowed at this time?
Please proceed.
Thank you. It's quite easier at this tamed and calm time coming out of the 2.5 years of the pandemic. Not to say it's completely eliminated, but the worst of it, I hope and pray, is over. And it's easy to possibly forget or put in the back of the recesses of our minds how traumatic it was, Chair Wilson. And I just want to once again provide accolades and commendations to the Emergency Operations Center team that was headed initially in 2020 by Director Paul Johnson, and equally with Dr. Elizabeth Richardson and former Mayor Eisenberger as, if you will, the troika that primarily provided leadership with much stakeholder and departmental input across the board and through our healthcare system as well, from experts in the community. I just want to say, when I look back in history, in my history lessons, what was it, Chair, about 100 years ago, when the Spanish flu hit upon the world's 2 billion population at that time, only 2 billion, they say conservatively a minimum 50 million people perished at that time. And fast forward to now, in our 8.5 billion population world we live in, I'm not sure what the final numbers were worldwide, but to look at our local situation in Hamilton, Chair Wilson, although every life valuable and important and sad that may have been lost during the pandemic, but I believe, Dr. Richardson, it was something like 670 lives in Hamilton only that perish, and I say that very thoughtfully and sensitively again, because every life is valuable and important, but looking at the city of our size, about 570,000 people, it's truly a miracle upon miracles with the worldwide plague, how well our community survived collectively, individually. Lots of pain, lots of anxiety, lots of uncertainty, fear for life across the board, and many, of course, from all sides of the spectrum, the extreme on the one end, the extreme on the other end. But I think the overwhelming majority of us, Chair Wilson, I'll consider myself in that group in the moderate middle, we recognize what we needed to do individually for us as leaders of this community as well, even more so. And I'm telling you, I was really extremely fearful and concerned in the early days and months of 2020, not even knowing what this virus, this COVID was, that came upon us and came from different parts of the world and landed in North America, and all the adaptations and adjustments in life somebody like myself as a traditionalist had to make to even survive from a workplace standpoint, truly looking back was remarkable and unprecedented. And so, Dr. Richardson, many praises were heaped upon you. And I know you and Paul Johnson won Citizen of the Year awards during the middle of the pandemic for your great leadership. And once again, I want to remind our community how lucky we were to have you. Thank you, Chair Wilson.
Thank you, Councillor. If I could ask Councillor Clark to assume the chair, please.
Yes, Councillor.
Thank you. I'd like to, first of all, acknowledge the heavy lifting done by members of the staff in the public health section, but they were joined by all employees of the City of Hamilton. And, you know, it's good sport to poke and prod and sometimes out of envy public servants. But I do know too many public servants in this organization who put in a full day only to then work at night in a volunteer capacity, helping those who are administering tests or vaccines. They had families, they had relationships, they had a life, but they put much of that on hold in service to others. So I'd like to acknowledge those individuals. Secondly, I would like to read into the public record some of the facts. From March of 2020 to December of 2022, we had 658 deaths reported as a consequence of COVID-19. We had 537,000 tests completed at Hamilton assessment centers, often by those assisted by those very volunteers that I'd referenced. And we had 1.4 million vaccine doses administered. Councillor Danko mentioned some of the challenges dealing with the provincial government on this file, and I too, it became almost predictable that it was on a Friday afternoon after 4 when there would be an announcement. And municipalities, including this one, were left scrambling to try and interpret what did that mean, what did the restrictions, how does that translate into our local activity, our choices? And sometimes our residents, in their exhaustion, took it out on local municipalities who were doing their best to scramble, interpret, and act in the service and the health service of residents. And I would hasten to say we exceeded and we excelled on many fronts in acting. For me, I really appreciated this report and the reflection in it. We are living in a time of where you would think facts matter, but I would hasten to say actually values matter more. Because it's that sense of your health is important to me, and I'm going to, out of respect, do all that I can to advance and maintain your health. And that sense and approach of community enterprise really translated into success and saved lives. So I'd like to take my my hat off to all of those Hamiltonians who assisted, cared for their neighbors, delivered meals, checked on neighbors as carefully as they could. Those things, I saw them. Those things are what makes community. And I would like to acknowledge the work, exhausting work of public health staff, of our health sector in general, of our universities, our colleges, and everyone who stood up and lent a hand. So thank you. Appreciate that. I'll take the chair back.
It's all yours.
Thank you. That 9.1, it has been duly moved and seconded. If we could vote on its receipt. Thumbs up for myself and Councillor McMeekin. Thank you. That carries 14-0. We're on to 9.2, dental program new build at Upper James. A mover and a seconder put the item on the floor. Moved by Councillor Danko, seconded by Councillor Taddison. Any speakers to this item? Councillor Jackson.
Thank you very much, Chair Wilson. A couple of questions through you to our wonderful Director Vickers-Manzin, who's been overseeing this oral health seniors dental care program. I saw in the earlier correspondence that I was a few minutes late coming into the meeting, Jennifer, that the $135,700 from the province of Ontario is going to carry forward into this year. I'm seeing that you need about $43,000 to open up or permanently open up the Upper James Clinic. Is one part of the other? In other words, is the provincial money being used towards that and further expanding this excellent seniors dental program? Maybe just a quick snapshot through you, Chair Wilson, please.
Thank you. I apologize. I should have asked the director to give us an overview, but this is a good opportunity in answer to your question to do both. Thank you, Director.
Thank you through the chair and to you, Councillor Jackson. I'll just briefly overview the report and just acknowledge that the report is about a new build at the Upper James site for our Ontario Seniors Dental Care Program, that this was approved in 2022 by the ministry. And the carryover of funds that have been approved is just to carry over the funds into 2023 so we can do the capital build. The $43,000 that you reference is in the upcoming discussion item. It's a separate dental report, and that's an annual cost for some of our assets that we need to purchase for the dental program overall. So they're a bit separate. But yes, the 100% funds for this build will be kept within that funding envelope.
Terrific, Director. Thank you for that overview and the reassurances and affirmation. Obviously, from a parochial standpoint, Chair Wilson, I'm very happy to see a second mountain location to go along with Sackville Hill Seniors Center. That this Upper James location will be permanent. Can you give us some indication? What's the uptake? I think we embarked upon this wonderful seniors dental healthcare program locally. I think we were one of the first in Ontario, Director Vickers-Manzin. And what's the uptake currently over the last 4 or 5 years? I think since it's been in place, and you speak of a wait list, but I didn't read any numbers in the report unless I missed it. Through you, Chair Wilson.
Director.
Through the chair to you, Councillor Jackson, I'll just ask Pat Armstrong, who's the manager of the dental program, to come to the mic, but as she's coming down, I'll just give you a few numbers. In 2022, we saw over 5,000 individuals through our Ontario Seniors. We had over 5,000 appointments and serviced close to 4,000 individuals through the Ontario Seniors Dental Care Program. The program remains in high demand just because of the backlog of services that occurred during the COVID redeployment. And so we do have a bit of a wait list for services. So this expansion of the clinic locations and space at Upper James will be a real asset. And I'll just turn it to Pat to give a sense of what the wait list for services for Ontario Seniors Dental Care Program is currently.
Thank you, Director. Manager Armstrong, please.
Through you, Chair. Thank you, Councillor Jackson.
Crank up that volume, at least for me, Manager.
Right in front of the mic.
Thank you.
Thank you.
Okay, thank you so much. We have approximately 300 seniors still on our wait list, and we're booking new patient exams about 5 months out right now. However, if there are emergencies, then the clients will be seen within the week.
Excellent, Manager. Thank you. Well, it's not excellent to hear 300 seniors are on the wait list, but that's how popular and most needed, Chair Wilson, this program is for our seniors in the community. I can't often oral health and the importance of oral health as people get older is often forgotten, and how important it is to self-esteem and to their overall health of their bodies and their system, and even the confidence they have if they don't have proper oral health. Can I ask, how has the mobile bus been overall as part of this program? Through you, Chair Wilson, to the Director. I think the mobile bus was to get to as many parts of our city as possible, if I recall correctly, Jennifer.
Through the chair to you, Councillor, thank you for the question. The seniors bus currently now is running 4 days a week in our community, and you will note in the report the locations, and we have chosen those locations very carefully based on areas of the city where we see pockets of low-income seniors to help ease access to those services. It is a mobile service. People are enjoying coming onto the bus and receiving those services. It's not without some of its challenges, providing services on a bus in a virtual world when we're taking x-rays, etc. We do continue to work through those challenges with our partners in IT at the corporation, and we seem to be ironing out the kinks, but it is a really appreciated service, and both our staff and the clients that attend the service speak really highly of the service that they receive on the bus. And I will just highlight as well, pre-pandemic, we were in the middle of coordinating a pilot with our long-term care home partners, starting with Macassa and Wentworth Lodge. That, of course, was put on hold during COVID, and we will be reinitiating that pilot this year with the help of Director Holly Eduardi.
Well, that was going to be my last subsequent question, Chair Wilson, about our two excellent long-term care facilities in Macassa and Wentworth, and you've got potentially 430 seniors there on limited disposable income, low-income seniors in our two long-term care facilities. I'm glad to hear you're going to reestablish that. You know, this is, just to conclude, Chair Wilson, this is a type of program where I find at least my constituents more than willing to put their public dollars towards providing services that otherwise low-income seniors just wouldn't have the ability to afford through either they don't have health benefits from a former job they may have had or not had, left as widows, widowers, whatever the case might be. I'm so proud of this corporation, this council, and the Public Health Department in providing this much-needed service across the community, and the next report will have my full support as well. Thanks, Chair Wilson.
Thank you. Yes, dental health is important, particularly for children as well, Councillor. Councillor Pauls.
And thank you. And through the chair, we heard it is for low-income seniors. But my question is, what does it cover, and what is the amount that it qualifies? And is it only for seniors? Is it a family as well?
Thank you. Director?
Thank you for the question. Through the chair to you, Councillor Pauls. The Ontario Seniors Dental Care Program is only for seniors. The age eligibility is 65 years plus. There are income cutoffs if you're a lone living senior, a single senior versus a couple seniors, and I'll just turn it to Pat to share what those are, as well as what's covered. But what is covered is prevention service, emergency services, some treatment services, as well as dentures are covered, and Pat can give us a little bit more detail. I will also just remind the Board of Health that in addition to the Ontario Seniors Dental Care Program, we also have an adult dental program that we offer in the City of Hamilton. That program is 100% levy funded. And we have another bus, which is our adult dental bus. And we also have clinic service hours dedicated to adults in our community. And then because the chair, Councillor Wilson, did mention the Healthy Smiles Ontario program, I will just highlight that that program is offered in our community for families with children 17 years of age and younger. And it starts with screening oral health in schools and also provides prevention, emergency, and clinical treatment services to children, youth, and families who meet the eligibility criteria. I'll just turn it over to Pat to add some more details should she have any.
Thank you. Good morning.
Good morning, through you, Chair. The cutoff for a single senior is just over $22,000 annually, and for a couple, it's just over $37,000. It's a comprehensive, fairly comprehensive dental care program, providing restorative as well as preventive services. We have oral surgeon who will do work for us, as well as root canals. So it's fairly comprehensive. We have 10 denturists in the city who are collaboratively working with us on this program. It's very good.
Thank you for that information. Councillor?
Thank you for that. Another question. You just said something about adult program, and it's 100% levy funded. What program is that? I wasn't aware of an adult program that the levy funds it all. Can you explain that?
Thank you, Director.
Through the chair to the councillor, we offer an adult dental program here in the City of Hamilton. So 18 years plus are eligible. There is a low income cutoff measure that's used to determine eligibility for the program. The program is offered mobilely through a dental bus, and it's also offered at several clinic locations throughout the city.
So that program, could that be funded from the province as well instead of levy? I never knew we had a levy funded one.
Director?
Through the chair to the councillor, this program, there is no provincially funded program offered to adults for dental. We in the City of Hamilton have a long history of offering this program to adults in our community. I will just also highlight for the Board of Health that federally, the National Dental Program is currently rolling out, and the intention of that national program is to roll out over the next coming years and to be completely rolled out in 2025. The eligibility right now for that program is 12 years of age and under, and there will be expansion to persons living with disabilities and seniors, and by 2025 the eligibility will roll out to all low-income individuals. So I highlight that because we will need to keep an eye on that federal program to understand what that means for us locally in terms of the programs that we offer.
Excellent. Thank you. Councillor Pauls, almost
That's
at your
great.
time.
Thank you. Last question, if I can. How many do we have in the adult program? How many?
Participants?
Yes.
Okay, thank you.
Through the chair to the councillor, I'm just going to turn that over to Pat Armstrong. And I think what you're asking is how many adults would we service per year through that program, and do we have a wait list for those services?
I'm seeing a nod from Councillor Pauls. Yes.
Through you, Chair, I'd have to get back to you on the exact number of adults for this year, but there is a short wait list for adults. I think there's about 75 adults on the wait list.
Thank you. If you're able, perhaps you could share that information when you have it accessible. Thank you to all members of this committee. Thank you. Councillor Pauls?
Yes, thank you, and I'm glad it's a short list, so thank you for the answers. Thank you.
Thank you. There are no other speakers, and that item has been duly moved and seconded, so if we could vote on it, please, and thank you. Thumbs up from myself, thumbs up from Councillor McMeekin. Carries 14-0. Thank you. We're on to 10.2, dental program specification around procurement. A mover and a seconder to put it on the floor. Councillor Wilson, Alex Wilson, Councillor Tattison, Mark Tattison. Any comments on this? Seeing none. It's been duly moved and seconded, please. Thumbs up from myself and thumbs up from Councillor McMeekin. Thank you. Carries 14-0. Notices of motion. Any being entertained today? Seeing none. We're on to general information. Other business. I need a mover and a seconder to approve the amendments to the outstanding business list. Moved by Councillor Alex Wilson, seconded by Councillor Tammy Wang. Any discussion on the OBL? Seeing none. Thumbs up from Councillor McMeekin and myself. Thank you. Carries 14-0. An adjournment, please. Councillor Wilson, Alex Wilson, Councillor Mark Tattison. And thumbs up from Councillor McMeekin, thumbs up from myself. And I'll see you all at 12:30 to see the e-scooters out front. Woohoo, yeah.
Councillor Crouch and Councillor Clark.
We are adjourned 14-0. On behalf of this committee, thank you to Public Health for your participation and guidance today. Thank you to clerks in the center of the horseshoe, and thank you all. Have a wonderful, safe, healthy day.